Yes. So one of the way that cholera is spread is through drinking wells that get contaminated because of pit
Yeah,
latrines. Is the council working with the fecal sludge management unit to ensure that pit latrines are not a health hazard?
yeah. Well, I think I was going there.
Mm.
We have we have a program, called the Lusaka Sanitation Program, which comprises Lusaka City Council, Ministry of Health, and Lusaka Water and Sanitation Company. This program is aimed at looking at how we can improve sanitation, especially in the urban poor and in the peri-urban parts of the city. Uh, so issues of pit latrines, these are things that we look at, as we call them, on-site sanitation. We, coupled with health education, we want to see how we can push people to have decent sanitary facilities. Even as it doesn't matter how much it costs, but let people have decent sanitary facilities, even if it's a pit latrine. So in our quest to have that, to push that agenda through the health
Mm.
education and also inspections of various communities, we are advising people to make sure that they cover the pit latrines to make sure there's no house flies crossing over from the latrines to their homes, because the house fly is a vector of a cholera
Yep.
disease. So this is something that we are actually doing. And then other than that, we're also embarking on liming of pit latrines, which will also act as a disinfection
Mm.
activity. Liming of pit latrines also will be helpful for us. And so these are a number of activities that we're doing. And also other than that, not only is it done in households, but also for sanitary facilities, we're extending this to public premises that trade in either food, they trade in liquor, and so on. So we're also intensifying the inspection to make sure that these public premises comply with the provisions of the Public Health Act, as it were, so that they can provide adequate sanitary accommodation and also cleanliness. And should we find any place that is non-compliant, our officers on the ground and will make the necessary recommendations. It means recommending foreclosure. That will be done so that we don't risk the lives of our people in the city.
At the beginning of this conversation, you did point out the fact that with cholera, I mean, it begins from individual level and eventually begins to affect the community and, well, the city at large in this case. Let's also look at where we are coming from now. So the first time we've had cholera being recorded in Zambia. In fact, we had an outbreak a few years ago. And just not so long ago, we've been facing the effects of COVID-19. But with COVID-19, even from a public health level, we've seen heightened levels of hygiene being maintained, obviously by you as the public health officials on individual level as well. Would you say that with the relaxation of the measures and with people's lack of adherence to some of these measures, we are now seeing the hygiene levels going down in the city?
To some extent, it's because, like I said, this is all about mindset shift. People don't wash their hands often. People don't sanitize often. The result is that obviously you'll be able to transmit the disease. So it's our appeal to the general public that let them make sure that they observe high levels of hygiene. Starting from washing their hands regularly, sanitizing, making sure that they keep the environments clean as well. Because a clean environment also is one sure way of keeping away vermins. Vermins in this case, we're talking about houseflies in this case, which are vectors of a disease like cholera. So if you have a clean environment, you are sure of avoiding such things as foul smells, which attract houseflies, and you won't have the houseflies that will transmit the disease of cholera.
Have there also been consistent sensitization programs going out, at least to make people in these communities be aware? I mean, we might take advantage or take that
Granted.
thought, take it for granted. Thank you, Francesca, that people are aware of what they need to do to avoid cholera. But has there been consistent sensitization going on in these communities, and also to avoid information fatigue, because sometimes when this information is being put out the same way all the time, people begin to be tired of it. So have there been new ways of making people aware of what they need to do to also avoid a very reactive approach, where we've seen cases now, then now we see people going to tell people what they need to be doing? Are we seeing consistent programs also of sensitization?
Yeah, definitely. We have taken another approach, excuse me, rather than just dealing with the communities directly, obviously through the various leadership structures. We've also taken the angle of targeting the schools, through the office of a district education board secretary. We have incorporated the Ministry of Health in our messages, of especially what we call water, sanitation, and hygiene, which is WASH programs. We've been training teachers in various zones of the city on the importance of water, sanitation, and hygiene, how they can make sure they promote aspects of hand washing, cleanliness in their schools, because we believe that children are better agents of communication, I think, than adults. So this is an ongoing program. Of course, it's and we've partnered with well wishers, and just today we have an orientation with our civic leaders, just on the same program. And it's an ongoing program, like I said. We believe that, like I said, children are an agent of communication, a better agent of communication, because they believe what the teachers tell them. So I believe that by capacity building the teachers with the information, the importance of WASH, as well as good waste management practices, this can trickle down to the children, and when the children get this message, they can also take it to their parents.